Hi, my name is Dr. Tim Speciale. Thanks for joining us today. This is a good friend and patient of mine, Mark, and we're here to talk about foot pain today. People don't realize when you look at a foot how important it is. And this little joint here is called the metatarsal phalangeal. The first one is where we get our push off, and it can cause a lot of problems. And Mark is here to tell a story and how he's had a good response to prolotherapy. Mark, would you tell me your story a little bit about what happened?
Sure.
What brought you here?
I was doing some work around the house and I was tipping over a heavy garbage can, very heavy, and I, with poor choice, using my foot as leverage on the toe, that came over and pushed the toe into a range of motion that it wasn't ready to accept. Didn't know at the time, but it led to a pretty substantial injury on the bones on both ends of the joint. A lot of swelling, and that little joint really can shut down your function. So I was looking for non-surgical ways to approach the healing process. Then I found him.
And what did you do, Mark, initially before you came here?
Went to the podiatrist. I ruled out, do x-rays, see if there was a fracture, no fracture. MRI, there was a bruising of the bone. And the route after that is typically cortisone injections and or surgery based on how things turn out. But I didn't want to follow that typical route. And in my profession, physical therapy, I try to avoid any kind of surgery along the way too. So.
And how long was this going on before you saw me, Mark?
Well, the process, each step takes time to see a doctor's visit, waiting, looking, so several months.
Okay.
Yeah.
So Mark came to me. Thanks, Mark. And how have you been doing now since your treatment, Mark?
Oh, it's a lot better than it was before. I was nervous to have my foot touched in the beginning, but with each successive injection and more trust in what he's doing over time, able to get a little more function, return to work, walk faster, do things around the house. So I'm coming out of the dark spot of the injury and looking forward to how things are improving.
Okay, thanks, Mark. So Mark gave a great presentation. He had severe sprain and arthritis, the metatarsal phalangeal joint. You can see Mark is a young guy. It affected his function, and it could affect your knee, your hip, your back, and he was frustrated. So initially we said, well, let's try basic prolotherapy, which was dextrose, and we helped him, but it still wasn't getting over the jump. So then we decided to take the second phase, which was platelet-rich prolotherapy. We did that, and he got a good response, and we were almost there, and then we decided to do it one more time. So basically he's had 3 sessions. His foot is getting rebuilt. He's probably 90% better. He has no pain now. He lost a little bit of motion of his extension. So now we're working on more mobilization and basically better range of motion. So he's doing well. He's going back to work. There's 3 types of prolotherapy that we talked about. One is basic prolotherapy with dextrose. The second is platelet-rich plasma. The third is stem cell with both belly fat and bone marrow, which we didn't have to do with Mark. So he's had a great response, and most people do get better with this. So thanks for joining us, and we look forward to seeing you again. Have a great day.